to Medical Monday every day. I'm your host, Dr. Grace Patterson, affectionately known as Dr. Grace. And we're going to be talking about a topic today that's near and dear to my heart about social media and effects on mental health. Did you know that about 70% of adults and 81% of teens utilize social media, which increases the risk of anxiety, depression, just feeling ill, and some of them have been even driven to suicide? Did you know that? But today what we're going to do, I have a good friend here today who is a psychologist. Her name is Dr. Joubert, who's been in practice for over 25 years. And we're going to delve into why, when people use social media and have these things happen to them, what is happening in the brain to make them go back to social media after feeling anxious or depressed? Dr. Joubert, thank you for being with us today.
Thank you for having me.
So let's delve into some questions here. So one of the things I want to know is if someone is feeling anxious, they're reading all these negative posts, and, why don't they just stop and I'm not just going to look at it anymore? What is driving them to go back and just suffer what they call cyberbullying?
Absolutely. So in general, social media and most outlets like that are created to keep people involved and active on social media. And what happens in the brain is every time someone gets a like or a following or something positive or even negative, the brain releases dopamine into the bloodstream, and it causes us to feel pleasure. Now, the pleasure that we get from social media, we tend to go back and try and get it again and try and get it again. So with each like, with each DM from someone, we get the exuberant feeling of happiness and joy. Be it real or imagined, it still feels good. So some people, even when there's something that's really negative that's going on, the anticipation of getting something positive gets you to come back again and again and again. Over time, like an addiction, it becomes something that you crave psychologically. And when you're craving that psychologically, you try to fulfill that need. One of the greatest needs of humans is pleasure. And so we seek pleasure in any way that we possibly can. And social media kind of answers that call when we need pleasure.
Wow. So it's basically the dopamine is what we know is a chemical that's released in the brain that people get used to. And it's the same release in any type of addiction, be it drugs,
Absolutely.
be it food,
Yes.
be it sex, all the things that you are talking about. One of the things that is concerning to me are our youth, we're giving our toddlers the cell phone to be quiet so they will stop crying, or so we can keep them busy to do what we need to do. So being exposed to that type of stimulant at such an early age, how do you think that's going to play in a child's mental health in the long run?
Well, the addicted child becomes the addicted teen, becomes the addicted adult. So if social media is not regulated and used the correct way, it becomes an addiction for them. It becomes something that they need, desire, want to get the gratification that we talked about. It is important that as social people, as human beings, that we are gratified and that we feel loved, that we feel liked, that we feel happy. And so whatever we are trained as a little person to receive that gratification from, we'll continue to do it if we're not taught or minimized in the way that we're taught to use social media the right way instead of as a crutch or a babysitter, or for parents most of the time will use it to get the children to be calm and just get out of their hair for a few minutes. So early on it seems like a great idea, but that same behavior will follow the child to adulthood.
So I heard you say use social media the right way. So as a clinical psychologist, what would you recommend for parents to do it the right way?
Now, social media has a plethora of things that are good about it. It opens up a big world and for people who can't get out and do all the things that you need to do or want to do. It gives you information. It connects you with people. It does a lot of things that are good. So using social media for the things to kind of promote you and to help you is what we would use social media for. But oftentimes that's not what's happening. People are using social media for self-gratification. They're using social media to judge themselves. They're using social media to, to bully, cyberbullying, as you mentioned. They use social media to see, what other people are doing and how they're measuring up to those other people. And that all those things cause mental health conditions or mental health struggles or distress or depression, anxiety. So using it the right way will promote you, but using the wrong way will cause mental health conditions or disorders or even just symptoms that affect your life.
Okay, so as a parent, how do you recognize, my child is getting too much social media or I'm on social media too much? What are the key signs to say, hey, I need to reach out and get some counseling or get some therapy or something? What would they have to look for to say, I need some help or my child needs some help?
If you're waking up in the morning and the first thing you do is social media, or the last thing you do before you go to bed is social media, and you find yourself throughout the day thinking about social media, checking your social media, then there's likely some issues going on. If you are judging yourself and finding fault in yourself and comparing yourself and feeling down, if you're isolating from other people and choosing social media over person-to-person interaction, that's a problem. If you are going to events and having a good time, but the entire time you're thinking about, I can't wait to post this, and the actual posting is more important than the event that you're engaging in, then you're having some issues. Those are some warning signs that social media has kind of inundated your life and taken over and is affecting your mental health.
Okay, so now I realize that me posting this event is more important. I'm like, oh my goodness. So what would be the next step for an individual to get, to say I need help? So what would be the next step of recognizing the issue and then implementing a plan to get the help that they need?
The next step is to kind of monitor how much you're actually using social media and how it's affecting you and why you use social media. Figuring out those things will kind of help you to determine, what is the next step for you. If you're using it a lot, and a lot would be multiple times a day, like I said before, nighttime, daytime, and it's constantly in your mind, then it's time to get some help. So when the social media, when people start to really constantly thinking about social media, then it's time to get some help as well.
Okay, so time to get help. So what does the help look like?
Okay.
Who is the person that they need to go to get the help?
Now, first you can start with yourself, and just once you monitor what you're doing and how you're doing it, you can kind of cut back. It's recommended for about 30 minutes a day for social media, and that will greatly influence your anxiety, your depression, and all the other symptoms that you may be experiencing. But for a lot of people, that's a lot of time that they're not on social media. So I wouldn't say that in the beginning that cut back to 30 minutes, especially if you're using it multiple times during the day. I would say gradually come down to about 30 minutes a day, and you will see that the anxiety and the depression will alleviate. If that's not happening, then you may need to seek mental health treatment, because there may be some underlying issues that are causing you to resort or to depend on social media instead of interacting with other people and getting the social gratification that you need from face-to-face contact rather than social media. So usually if there's excessive use of social media, there is some underlying issue that the person is trying to resolve. It may become like a blanket, a security blanket, which is a false sense of security, but indeed is still a security blanket where people will go to social media instead of going to someone else to talk because they feel inferior. Or they may go to social media to create a false persona so that they can feel better about themselves. So if you see that all those things are starting to happen for you, it would be really important to seek mental health treatment so that you can get some help resolving those issues.
Right. So I just want to interject there while you were talking about monitoring. We all have our cell phones, and you can log and see how much screen time that you're on your phone, even social media. And I recommend people to start there. And I know for a fact for parents with their children, they can lock them out after a certain period of time. We do recommend that as well. And so one of the things I want to talk about right here are what are some of the signs of symptoms of depression, because it comes in many forms and shapes, and then we'll talk about anxiety after that.
Okay. So most people, when you say depression, they think that you are always crying or something like that. But depression will be you're not eating well anymore. You may withdraw from friends, family. You may feel down and depressed or sad most of the day or nearly every day. Depression, like the commercial says, sometimes I know if people are familiar with depression hurts. It actually will give you physical pain where you feel ill. Some people, it may manifest in an illness. So for different people, depression manifests different ways, but overall, it's just a continuous feeling of sadness, worthlessness, just overall, I don't feel good and I don't want to do anything. I don't want to get up. I don't want to go anywhere type of feeling.
Okay, and so social media plays a role in that because they're getting all these constant dopamine hits, right? And then when they don't get them, then their mood is depressed.
Their mood is depressed, yes.
Wow.
Yes. And then the hits from Snapchat, when everybody's looking great and you're not looking great in your picture, or just the wonderful world and the wonderful house that people are showing that is realistic, but at times not realistic. That makes you devalue yourself, which creates a poor self-esteem and just the worthlessness, and which contributes to the depression.
Okay, so that's the depression in social media, you know, the dopamine and how that affects that. So what about anxiety?
The anxiety of just anticipating what's going on social media. There's a term they use as which is FOMOT, which is, I forgot the exact what it is, but it's basically saying that or the fear of missing out. That's what it is, the fear of missing out. So people actually have anxieties about, what if I'm not invited to this event? If I missed it, then am I worthy? Are my friends still my friends? The fear of missing out and saying things like, well, the worst thing could happen is somebody said, did you see this on social media? And for you to say no, the anxiety builds up because now you start questioning yourself, who you are. So anxiety plays a big role in creating the depression as well. So they go hand in hand.
All right, well, thank you for that. Stay tuned for the next segment of our show. We're going to definitely go into some things that's going to give you some tools to handle the social media and mental health.
Impact, where urban family, faith, lifestyle, entertainment, culture, collide, all here on Impact.
Your Impact Network has gone mobile. Now we'll be there wherever you are, whenever you need us. Our brand new app allows you to stream our complete lineup of preaching, ministry, and music 24/7. All of your favorite programs in the palm of your hand and just a click away. Impact's app features our content schedule for quick and easy searching and a Bible reading plan so you never miss daily devotions. We also have a brand new video on demand section so you can enjoy what you want exactly when you want. Regardless of your circumstance, the Impact Network will provide the ministry programs desired. Our goal is to have a positive impact on you and the lives of others. We also have an easy-to-use support button, allowing you to donate quickly, partnering with us as we preach the gospel around the world. Your Impact Network is now available in the App Store on all mobile platforms. Download it today and tell your friends.
Okay, welcome back. We're going to continue on this road of social media and effects on mental health. And again, near and dear to my heart are the children. So, Dr. Wanda, I've seen posting on social media or children on a plane and they can't have their phone. They have this horrible meltdown. It's like they're crying and screaming, I want my phone, or even at home, no, I want my phone, or I want my iPad or their tablet. So explain what is going on and explain what parents can do to handle that situation.
I think the first thing parents need to understand when the kids are having a meltdown, that it's not a fair fight. It's the product design that keeps kids and adults kind of drawn into interacting with the device or with the social media, whatever it might be that is drawing their attention. And when parents abruptly take a device from a child, just like with adults, it is activating their pleasure center. They're getting gratification from it. And when you're just abruptly taking it from them, you are just shutting it down and not giving them anything that is pleasurable. Most of the time it's bedtime, or it's do your homework, or something that's not really desirable by the child. So when you take something desirable and you give me something back that's not very desirable, and you expect that because they don't have very good use of words or being able to express that right now I was feeling really good, and you just took that all away from me, the meltdown happens. So for parents, immediately they want to, discipline, or maybe you just give it back to them because they're acting up in the store, acting up on a plane. But doing that actually reinforces it because they now get that pleasure right back again. What needs to happen with parents is they need to set limits before they provide a device. Early on, when they start to give kids computers or cell phones, or allow them to use their devices, start there with setting limits, because you can't really set limits once the addiction has developed, because at that point the kids are, taken away from them causes them distress. So just setting the limits early, giving screen time a time limit so that the children will know and understand that this is for now, and then when it's time to do homework, time to go to bed, time to just sit quietly, it is that time. So their brains understand that I get this pleasure during this period of time, but at this time it's time for bedtime.
Wow, and that's troubling to me when you said about the addiction piece. I mean, we're talking about children. We're talking about toddlers. I've seen toddlers they can do stuff on the iPad and the Apples, and just devices that I can't do.
Absolutely.
And so to just hear about addiction starting so early in childhood, and how it, like you said, addicted child becomes an addicted teen, and addicted teen becomes an addicted adult. So and you said in parameters. So let's say, for all intents and purposes, let's create a scenario right now. Okay, you have this teen now that is addicted to social media, to the stimulant of the dopamine from the devices. What do we do?
Like any addiction, you have to try and actually decrease the addiction, or to just extinguish it altogether. How do we do that? You start by setting limits. Even though that child may have some temper tantrum because of the, be it a teen or a toddler, because we know both of them can have some pretty big temper tantrums, you still have to set the limits. And when you set the limits, you have to stick to the limits and be consistent with them. First, you kind of explain to the child what is happening to them. Right now, you are spending too much time on social media, or too much time with your tablet. And what we want to do is implement some more things in your life that are not social media related, like going outside and running and skipping and jumping and have some good times. Or for older people, older children, just getting out and interacting with other people, children their age. Create some activities that they're doing that doesn't involve social media, like maybe a sport or some type of artistic type thing that they can do. So doing that starts to break the cycle of the addiction to whatever it is that they're doing. And also, it's important for family or parents to understand, why is my child addicted to this? Why is she not playing? Why is he not interacting with peers? So when we kind of explore those things with the child, we're more likely to understand what's going on and can help them kick the habit.
Okay, well, thank you for that. We do have a phone call right now. Vanessa from Michigan, she has a question about the topic that we're talking about today.
Thank you so much, Dr. Grace. I wanted to just find out if you guys are aware of the ACE and the adverse childhood experiences, and if we could understand that even better, perhaps we could do more in regards to how we react to children's behavior.
Why don't you say it?
I didn't hear the first part.
The adverse effect. Could you say that one more
The
time?
adverse ACEs, which is an acronym for Adverse Childhood Experiences.
And you're asking about
If you can,
go ahead.
as you're talking about children and their behavior, and you're talking about what parents can do or not do, are you guys aware of the impact of ACEs on a child's behavior? And perhaps if we could educate more parents in that area, then they could have more tools or more knowledge or information in how to treat those type of behaviors that causes problems in a child's, development or using of devices.
Okay. So I think I heard you correctly. You were talking about the adverse child behaviors and things that...
Childhood, yes.
Again?
Yes, you're correct.
Okay.
Adverse childhood experiences.
Yes. So, and I think what you're referring to is just things that happen during childhood that causes problems during their childhood. Some of that could be developmental, birth things, or maybe some type of childhood trauma that they may experience.
Correct.
Is that they may experience that causes additional problems in their life. So when kids experience childhood traumas, no matter what it may be, it may kind of change their developmental perspective or change their developmental growth. And when that happens, it compounds. So a lot of kids, when they have had trauma, they don't attach well to other people. So they may have difficulty interacting with folks or interacting with peers as well. And when you see that trouble, because of social media, and it's kind of shields them from actually interacting personally, they will seek social media as a way to get the gratification they need. And once they find that to be a safe place, they will continue to do that. Now, parents who see that happening, especially in kids with trauma, they should recognize that and find ways to promote socialization in other ways other than social media. And that will be some additional help from the parents because they don't have the skills or the knowledge to be able to do that due to trauma or different situations that happened in childhood.
Yes, great. Thank you so much.
Thank you, Vanessa. We have another call, Linda from Michigan.
Yes, hi.
Hi, Linda.
Hi, one moment. Okay. Hi. So my question is social media really the reason for, suicidal thoughts? Because I'm wondering if that thought is already within that individual's mind, just piggybacking off of the last question, such as childhood trauma or family history. Is that thought already there? Or is social media really the reason for those particular thoughts?
Okay. So social media is not the reason, but it helps to exacerbate anything that's going on. Now, not always the reason, I'll say that, but sometimes social media can be the reason. There's a lot of sites online that promote suicide or can glamorize suicide. But to answer the other part of your question, sometimes people have the vulnerability or depression or things going on, and because they're seeing things on social media that support suicide,
Right.
or they see other people committing suicide, then they see that as an option, a way
Right,
out of what's
right.
going on with them.
Right, because I was thinking, was it more so the challenges that they are starting to do that make them do unhealthy things or things that they shouldn't do, and that's resulting in suicidal things? Or, like you said, there's a lot of things that promote, suicide as an option.
It definitely promotes, and because of the depression and anxiety that's created by just being in a social media world, and that's pretty unrealistic most of the time, that if they can't live up to what's going on or live up to that Snapchat model or Instagram model, or if they're a kid, live up to their friends who are doing everything fun during the summer, then they'll decide that suicide is the way, and then they'll find support on social media that suggests that, you know, it's a good idea or it's a way out.
Yeah, I agree.
Well, thank you, Linda, for calling in. We have a few more minutes. I have a question for you. Since we talked about all of this, you know, we hear that there's some good and bad with social media. Mm-hmm. Now, people hear this, you know, like, okay, the bad side of it, but they're tending to be like, oh, well, whatever. What can you say, or what can you do to encourage people and to say, you know, this is an issue. I need to get some help. What would you say to the audience today to encourage them, especially after listening how there are sites out there that support suicide? What can you say to encourage our audience to reach out if they see these signs and symptoms?
It's really hard for you to tell somebody that, or for them to hear that something that feels so good is bad. So when you're talking to people, instead of just telling them about all the bad things, just ask them some questions about, are you judging yourself? Are you on social media many hours a day? And just kind of relate to what's going on with them. Or you just may have to ask them, what is going on? Why are you posting every 5 minutes and not enjoying your experience, but you're actually posting? So I think for most of the people, it's just kind of having a conversation with them and encouraging them rather than trying to ridicule with saying these things are so bad.
All right, we only have a few moments left. So when do they say, I need to pick up the phone to call Dr. Joubert? When should they do that?
When you find yourself overwhelmed and doing all the things that we talked about, then it's time to call someone. If you cannot resolve it within yourself or with a friend or someone, you need to call and get some help, because we don't want you to be the person who commits suicide because of the depression or anxiety that you're experiencing due to social media.
All right, well, thank you so much. Thank you, everyone, for tuning in to Medical Monday every day. We had covered a whole bunch of things today, but guess what? We want to make sure that you quiet your mind, quiet your heart, and make sure that you stay whole. Until next time.